So we treated Cassandra in 10 degrees of extension, and the table is now set at neutral. And she has free mobility. I can take up the slack, and then I can bounce. I can do traction, and I can see your feet move up and down.
Uh-huh.
And that was lacking before in neutral, and it was lacking in flexion. So now you're in 10 degrees or more of flexion. I can take up the slack and I can spring it.
Uh-huh.
And then I'll put you back in neutral. And then I'm going to come on the transverse processes of C1. And I can glide you freely.
Oh, wow.
See how free that is?
Yeah.
And then if I come underneath C1, and I put you in slight flexion to get access, I'm underneath each side of C1, and I can induce rotation really freely.
Yeah.
So I'm pleased with this game.
Yeah.
Let's have you sit up and tell me how you feel.
Okay.
You can move your neck around.
Oh, yeah. Oh, that feels really good. But I couldn't do that before.
Couldn't do what?
I just couldn't move and just roll and feel like it can move. It's like the magic 8-ball things that they do like that. That's how my head feels like I can do that.
So you feel like you can roll it multiple, like in a figure eight?
Yeah, I can, and no constriction.
Beautiful.
Ooh,
Beautiful. You want to know the good news?
Yeah.
You can keep it.
Awesome.
You can keep that motion. Tomorrow I'll teach you some really simple exercises. I have another YouTube video up, and it's called Upper Cervical Exercises. You can find it by doing the search with those words, Upper Cervical Exercises.
Okay.
And put my last name in there, Hesch.
Okay.
H-E-S, like Sam, C-H.
Okay.
And it's done in a neck cradle called Dr. Ryder's Real Ease.
Okay.
And it's about $30 on Amazon. And it is really a very, very nice cradle because it lets you isolate movement in the upper cervical spine. It kind of blocks motion in the mid and lower cervical.
Okay, so you can really get in there and keep that.
So we'll show you that and have you do that. And honestly, you're going to be able to keep this motion.
I'm so happy I'm going to cry.
Take a short walk and see how you feel. Walk in the hall and come back and then give us a report.
Okay. Wow. Once or twice.
Oh, once. Come on back.
Yeah.
What did you notice walking?
I feel like my body can hold itself upright. My head's up stronger and straighter. I mean, I used to kind of like slump and have to like drag myself around because that's how I just was all constricted and discombobulated, if you will. And now it's like I'm moving to that SI part is not hurting me, and I can that rib.
There's rib mobility. There's trunk mobility.
Yeah.
There's trunk rotation.
And I also feel like that inner core being able to pull up again.
Nice.
I mean, because I can feel it where it's,
Nice. And for the viewers, we did do other work.
Oh, yes.
We also treated the hips.
Yeah.
And there was a shift in the pubic joint that we treated.
Yeah.
So you're describing some of the effect from the other treatment as well.
And I specifically note that my head is elongated. My neck is elongated.
Nice.
Yeah.
It all sounds good to me.
Yeah, me too.
I'll take it.
Yeah, definitely.
Thank you.
Oh my gosh, thank you.
Thanks for letting us film. I appreciate it.
No problem. I'm gonna